Today our topic is fallopian tubes. Fallopian tubes or the uterine tubes, oviducts, salpinx. These are the other names for the uterine tubes. They are the muscular J-shaped tubes found in the female reproductive tract. They lie in the upper border of the broad ligament, extending laterally from the uterus, opening into the abdominal cavity near the ovaries. This article will look at the function, parts, vasculature and the innervation of the fallopian tubes as well as any clinical relevance related to the uterine tubes. This is the structure of the fallopian tube, which is two-sided one next to the uterus and ovaries, which is connected to the ovaries and uterus. The main function of the uterine tubes is to assist the transfer and the transport of the ovum from the ovary to the uterus. The ultrastructure of the uterine tubes facilitates the movement of the female gamete. The inner mucosa is lined with the ciliated communal epithelial cell and the peg cell, which is non-ciliated secretory cell. They waft the ovum towards the uterus and supply it with the nutrients. The smooth muscle layer contacts to assist with the transportation of the ova and sperm. Muscle is sensitive to sex steroids and thus peristalsis is greatest when the estrogen levels are high. Anatomical structure. The female tube is described as having the four parts, lateral to the medial. Fimbriae, they are the finger-like projection, ciliated projection, which is capture the ovum from the surface of the ovary. Infundibulum, they are funnel-shaped opening near the ovary to which the fimbriae are attached. Ampulla, this is the widest section of the uterine tube. Fertilization usually occurs here. Isthmus, this is the narrow section of the uterine tube connecting the ampulla to the uterine cavity. As I said before, the fertilization process takes place in the ampulla. The last part is the isthmus, and the finger-like projection is the fimbriae, and next to the fimbriae is the infundibulum. Vascular supply and the lymphatics. The arterial supply to the uterine tubes is via the uterine and the ovarian artery. The venous drainage is via the uterine and the ovarian veins. Uterine and the ovarian veins is the venous drainage, and the arterial supply is uterine and the ovarian arteries. Lymphatic drainage. This is via the iliac, sacral, aortic lymph nodes. Innervation. The uterine tubes receive both sympathetic and the parasympathetic innervation via the nerve fibers from the ovarian and the uterine plexus. Sensory afferent fibers run from T11 to L1. Clinical relevance. Salpingitis. This is the inflammation of the uterine tubes that is usually caused by the bacterial innervation or infection. It can cause the adhesion of the mucus, which may partially or completely block the lumen of the uterine tubes. This can potentially result in the infertility or the ectopic pregnancy. Ectopic pregnancy, if the lumen of the uterine tube is partially occluded, sperm may be able to pass through and fertilize the ovum. However, the fertilized egg may not be able to pass through the uterus and can implant in the uterine tube. This is known as the ectopic pregnancy. An ectopic pregnancy is called the medical emergency. If not diagnosed early, the implanted blastocyst can cause the rupture and hemorrhage of the affected tube. This is the uterine tube, which is affected with the blastocyst rupture here. This causes the ectopic pregnancy. Ligation of the uterine tube. The surgical cutting of the uterine tube is called the done by the method of sterilization. The oocyst is unable to pass into the uterus and therefore cannot protest to the pregnancy. There are two main methods of ligation. One is open abdominal and another one is laparoscopic. Open abdominal carried out via the suprapubic incision in the abdominal wall. Laparoscopic, this is carried out via the fiber optic laparoscope, inserted via the small incision near the umbilicus. Thank you.